right, so we chose the Cognitive Linguistic Quick Test, better known as the CLQT. Ours is actually the CLQT Plus, but our LSU's clinic didn't have that, so we're just going to kind of teach all about this one. They're very similar. And just a disclaimer, the information obtained from the CLQT manual is for educational purposes only. So we're just going to do a little overview of the CLQT. The purpose of this assessment is to quickly assess the status of 5 cognitive domains in adults that are believed to have neurological dysfunction. These 5 domains are attention, memory, language, executive function, and visuospatial skills. This assessment also has 10 tasks that help to target and test these domains, which we will go into more depth later. And the most important thing about this test, it is not meant to be used as a comprehensive tool to determine diagnosis, but rather just a guide to acquire a more in-depth domain-specific testing. So now Madeline's going to kind of quickly go through the domains.
So the 5 domains that are targeted in the CLQT are, the first is attention, and it targets vigilant selection and executive attention. It also targets procedural working, semantic, and episodic memory. It also targets executive function, which allows us the ability to flexibly plan, sequence, implement, and accomplish goals. It targets all of the 5 components of language, as well as visual perception, construction, of visuospatial skills.
Okay, and so this is just a little overview of the administration task. So first we're going to go through the general administration guidelines. And really the only important thing you need to know here is whenever you have the record form, you always read the dark blue instructions to the examinee. And that's like the most important, read it word for word. And that's what you should do. And then these are just some important notes about the prompts and probes, the responses, and repeating questions. So just always make sure you have a neutral response, like we're almost done, or only a few more to do. Never say like good job. Don't give the client any identifying factor that they're doing okay. You should only repeat the instructions for each test one time if they're confused or if they need help. And all the tests have time limits except for the personal facts, so don't give credit for any response that's after the time limit is up. So Madeline's going to go through the first 5 with us.
So the first task is personal facts, and it just assesses episodic memory. And it's just a really simple task. You just ask basic questions, like such as the client's place and date of birth, current address, or current age. The second is symbol cancellation, and this assesses visual attention, scanning, discrimination, inhibition, and response shifting. And the client is shown a page like the one in the example, and there is a target symbol, and they have to cross off all of those target symbols. The third is confrontation naming, and they just labeled 10 simple drawings just to document any signs of anomia, which is a word retrieval difficulty. And the fourth is clock drawing, and this just assesses really quickly just spontaneous recovery due to any language regression from a progressive disease. And they just write the numbers on a standard clock, and they draw the hands to say 10 minutes after 11. The fifth is story retell, and there are 2 tasks, subtasks within this one task. The first one is just a story retell. You just repeat what the examiner said. And then the second one is an auditory processing, and you answer yes or no questions based on the story.
So the 6th one is the symbols trails. This basically just assesses their working memory, their planning, and mental flexibility of the client's language system. So they have 2 trial tasks. One is they just draw lines to connect the symbols by size. The second is to connect symbols by shapes. And the one that you will score is when you ask them to draw lines to connect shapes that are alternating between triangles and circles from smallest to largest. The next one is generative naming. So this one just evaluates the client's ability to conduct a mental search for specific words. The first subtest is to asking them to retrieve a name as many animals as possible. And the second one is to retrieve and name as many words starting with the letter M, but it has to be lowercase m's, none with uppercase m's. So, and they're given a minute for each subtest on this one. The eighth one is design memory. So this assesses the working and visual memory with minimal language demands. So basically, the clinician presents the design pairs, which you're going to have 2 target stimuluses, and you show them that for about 20 seconds, and then you flip to the next one where they have 6 abstract designs, and they have to point out the stimulus design. The ninth one is mazes. So basically it just helps to assess the executive function with minimal demands. And they're really just drawing lines to solve varying difficulties of mazes. And the last one is design generation. So this one just assesses their ability to be productive and creative while also having the ability to vary their responses. So all you do is you have the client create as many designs as possible by connecting 4 dots with 4 straight lines, and they get 3 minutes. And something that we just want to let you guys know, we have all of our demonstration videos on our handout. There's a link to a PowerPoint that has every administration, like a video, just to kind of go through the like instructions and stuff that you guys can watch if you need more help. So now we're going into the scoring, and I think Madeline's going to go through the scoring with us.
So to score the personal facts, you just score 1 point for a correct response and 0 points if it's an incorrect response. And you also can circle a description of how it was answered. And all of these scoring, the really specific scoring instructions are on the record form. But for symbol cancellation, you want to find the symbol cancellation score. So first, you count the number of incorrectly canceled symbols and the number of correctly canceled symbols to get that score. The third, for confrontation naming, 1 point for a correct response, half a point for a half correct response, and 0 points if the response was either written or gestured. For clock drawing, you place a check in an appropriate box on the record form. It has all of the scoring elements, and there's 11 different ways you could draw the clock. For story retell, for the retell part, you check off boxes in a column if the examinee correctly recalls what happened in the story. And for the auditory comprehension, you circle 1 if it's a correct response or 0 if it's incorrect. For the symbols trails, you score 1 point for each correctly drawn line. And then for generative naming, you mark a C for a correct response, a P for a preservation of any response, or an I for an incorrect response. And for the animal and M-word responses, if the animals are all correct and they name M-words, you give them a score of 1, or if they're incorrect, a score of 0. Here's an example. And for design memory, you circle the designs that the examinee chooses, and if they choose the correct design, you give them a score of 1, or if they choose the incorrect design, it's a score of 0. For mazes, for the first maze, you can have a total of 4 points, and for the second maze, you can get a total of 3 points. And you subtract 1 point each time a line goes a half an inch or more past the opening of an alley. And you score 0 points if the line doesn't begin at the arrow, if the line crosses a wall, or if the examinee stops the maze. And for design generation, you want to get the design generation score, and there are 13 different possible designs, and the specific instructions to do that are on the record form.
And now this is just like a little quick overview of interpreting the results. So this test uses a severity rating for each language domain with all the tasks except for the clock drawing task. And this severity index chart is found on the back of the response form. And it consists of mild, moderate, severe, and within normal limits. And like stated earlier, the clock drawing task has a separate severity scale that can be found in the manual. So just to conclude, we're just going to go through the things that we found were the strengths and weaknesses for this test. So obviously it's a quick assessment, so it's about 10 to 15 minutes for very experienced clinicians. It gives a good comprehensive overview of all domains, but again, it can't be used as the only to have a diagnosis. And it is available in English and Spanish, so that's a big plus. Some weaknesses we found: it cannot be used as a standalone assessment, as we talked before, to have a diagnosis, and the scoring can be very subjective for some administration tasks like the clock drawing. We're excited. That's it for us. So thanks for listening to our presentation about the CLQT.